Welcome back to the world of biotechnology. I'm Caylee.
And I'm Natalie, and today we will be joined by Dr. Andrea Carney, who's going to tell us a little bit about vaccines. Now, down to you, Josephine.
Thanks, guys. Today I'm here with Andrea Carney, MD. She's going to tell us a little bit about herself, and then I'm going to ask her a couple questions relating to vaccines, and she's going to tell us a little bit more about them.
Thank you. So my name's Andrea Carney. I'm a medical resident at CMAR up in Marysville, but I work at the Hospital Providence in downtown Everett. So I'm an MD. I went to medical school, and right now I'm just completing my training in family medicine.
Thanks. So a couple questions. What are some of the risks and benefits of vaccines in general?
Yeah, so vaccines, thankfully there have been many studies conducted by the FDA, by the CDC, trying to prove the safety profile of all of those. So very few risks. With any sort of medical intervention, there's always a risk that somebody can have an allergic reaction to something. That's true of any medication, and a vaccine is a type of medication. So the greatest risk is what's called anaphylaxis, or severe allergic reaction. If you think of somebody who's allergic to like peanut butter or shellfish, it's a similar reaction. Thankfully, vaccines are only administered at places like Walgreens or the doctor's office, like some sort of area where there are medical personnel on hand, and they can administer, whatever you need in case somebody has an allergic reaction. That's the greatest risk. And then in terms of benefit, the benefit would be you have protection against whatever disease you're getting inoculated against. So that depends on what kind of vaccine. There is some information that's questioning if there are other risks to vaccines. And there are multiple sources that are sort of expressing concern that there might be an increased risk of, say, autoimmune diseases or things like asthma or other adverse reactions. There hasn't been any causational evidence. So there have been a lot of studies looking at this and looking at the safety of vaccines, but there's been no evidence that vaccines actually increase your risk for things like autoimmune diseases. So that's very reassuring.
Okay, thank you. Why do some places in the world not have any access to vaccines?
Mm-hmm. Yeah, so it depends on what place you're looking at. Some places it's a matter of infrastructure. Perhaps you just don't have the support from the government to actually get the vaccines out into the population. For some places it's a matter of, maybe you're in a tropical environment, and for some vaccines you need to keep them at a cooler temperature to make sure they don't spoil, just like food. And if you're working against things like power outages, or you simply just don't have like the supplies, like trucks, or just people on the ground to deliver the actual vaccines, that can be a hindrance to getting them out to the population.
Okay. What diseases don't have a vaccine to prevent it? Can you give a couple examples of those?
Sure. So I used to work at NIH. I did a little bit of work there before I went to medical school, and so there are always new vaccines working to be developed. So one of the biggest examples would be HIV. They do a lot of research trying to develop that, just because that's a disease that has so much impact around the world, and especially if you're thinking about global health, that's a big one that definitely has a wide-reaching impact. So a lot of work on HIV, also a lot of work on malaria, definitely impacts global health as well.
And then to follow that, is there any vaccines that are being approved that might be in the final stages of process that you know of? So like in the process of being approved by the FDA or the CDC?
They're always working on things like the flu vaccine every year, like trying to refine that on an annual basis, but I know that at least at NIH, they've been working on trying to get the HIV and malaria vaccine for many, many years. I have no idea when those are going to be done, but that's pretty cutting edge work.
And then what are some of the circumstances or like lack of resources that make it hard to make a vaccine?
Difficult to make a vaccine. It may simply be a lack of information. It might be just a lack of resources, lack of people doing the research. It kind of depends.
Okay. And then why do some vaccines not work for like specific people or just in general?
Yeah, good question. So the most easy to reach, for example, would be something like the flu vaccine. And the problem with the flu vaccine is it's kind of like the common cold in that So there are so many different kinds of colds you can have because the virus can change different proteins on its surface that make it difficult to predict how it's going to interact with the human host. So that's why the flu vaccine is new every year, because what institutions like the FDA and CDC try to do is they try to predict what's going to be the most common strain of the flu virus that people are going to see every year. So they try to synthesize a vaccine that will most easily predict that reaction and just base it on data. It's all based on data. So that changes every year, and that means that every year it's a new vaccine, and we can't always predict how effective it's going to be. So for example, last year, 2018, the vaccine was maybe 30-ish% effective. This year it's much more effective. It totally depends. I want to say closer to 50% effective, maybe a little bit higher. And for something like the flu vaccine, where it's never a guarantee, like something, for example, like measles, mumps, rubella, that's been pretty stable for the past many years. The flu changes every year, so it's so hard to predict how the population is going to react to it, or not react to it, is going to be protected by it.
And then a quick follow-up question for that. So you said that the flu changes every year. Is there a vaccine that changes every year, or is the flu vaccine that they administer, is that changing slightly but it has like the same basis?
So the flu vaccine is made of an inactivated part of the vaccine, and that part changes every year because they're trying to get the data to figure out, what vaccine presentation am I going to make the vaccine out of this year.
Okay. And then do all vaccines have to be approved by the FDA and the CDC?
Yes. So the CDC is the main arm that sort of develops the vaccine, and they have to go through multiple years of testing and trials. So with any sort of medication or therapy or anything like that, there's phase 1, phase 2, phase 3, phase 4, and all of these stages take multiple volunteers and multiple years. So it usually takes at least 8 years to develop and synthesize a vaccine and have it be ready to actually administer to the public. It takes a long time.
And then what, these are released into the public only after they have been approved by the FDA and CDC?
That's correct. So phase 1 is looking at, the actual safety. Is this something that I can give to a person without harming them? So they're looking at toxicity levels, looking at how people react to them, any potential allergic reactions, and trying to minimize that. Phase 2 and 3 is looking more at the doses, like what kind of dose do I need to make this actually effective? And then phase 4 is when you're actually trying to get it into the public, and is this effective in the general population? Can I apply this to a maximum amount of people, and is it sort of generalizable? Can I give this to everybody and have them react pretty predictably to it?
Okay, for all your time. Back up to you guys.
Thank you both for being here today and sharing with us. Join us tomorrow for more about the world of biotechnology.